my knees and pray. Source of living water, when the world cries asking why, I get on my knees and pray. Get on my knees and pray. Cry to God the Father, for I know that He's quick to hear when I get on my knees and pray. For I know that He's quick to hear when I get on my knees and pray. Knees and pray.
I'll be on my knees. Oh, yes, I will.
Knees and pray.
I'll be calling my Savior. Oh, yes, I will.
Knees and pray.
I'll be on my knees. Yes, I will.
Knees and pray.
I'll be calling on Jehovah Jireh, my provider. I'll be calling on Jehovah Rapha, my
healer.
I'll be calling on Jehovah El Shaddai.
And pray.
Good up that time.
Knees and pray.
Greetings, saints. Hope I find you well this evening. We are welcoming you to the program Health and Mission. Today, I have Dr.Alvina Makurumidze. Welcome to Viewers Talk.
Thank you so much for having me.
Okay, today we are discussing about breast cancer. Doc, breast cancer, a disease that is second to cervical cancer in being deadly or fatal. A disease that has threatened an anatomy which has been blessed for nourishing and nurturing mankind. What is it?
So, breast cancer, like you've rightfully said, comes second to cervical cancer.
Yes.
And it's a disease that unfortunately we're seeing more and more of in our community at large. It's a cancer of the breast. And it's among us. It has come in full force, and we have to deal with it as soon and as best as we can.
Why now in full force, Doc? Has it been there? And if it is now in full force, if it has been there in the past and it's been kept, why in full force now?
Well, basically because like all cancers and all chronic lifestyle diseases, they're all on the rise. Basically because we are changing the way in which we live our lives, we're changing the way in which we eat, we're changing the way in which we conduct ourselves in our day-to-day lives, be it in our diet, be it in our forms of exercise, be it in the exposure to toxins that we have due to workplace, cosmetics, and the like. So we've got this shift from the usual infectious diseases.
So it's been a paradigm shift.
Exactly.
All
exactly.
right.
So we are going towards the Western diseases, as some would like to put it, which we didn't have before because of the changes in our lifestyle that we are having.
Of interest, Doc, it has come to my knowledge that this disease is not only as perceived a gender disease.
Yeah.
It affects both males and females. People, when they think of breast, they think of females. But now it goes on to both males and females. Is that correct? Is it true? Okay.
Yes, definitely. Because, culturally or socially speaking, people would think that breasts are a female feature because they are more prominent in females.
Oh, okay.
But we do know that men and women do have breasts. And when men are born with their breasts, they do have breast tissue. But what happens is at puberty, women develop more breast tissue. And it becomes more prominent.
Okay.
And in males, they do not have that change, but they continue to have that breast tissue. And that tissue is still prone to cancer in as much as females are prone to cancer because they have the same tissue, though in different amounts.
So as much as it is in both males and females, what causes this breast cancer? You've alluded to lifestyle changes and what have you. Is it the only thing that causes breast cancer?
Okay.
Are there any other artificial or natural causes that are not related to those we have mentioned before?
Okay. So with cancer at large, it's a disease of your own tissue that has become unruly, if you'd like to put
Yes,
it
that's what we wanted to come, because the metastasizing and everything that happens, it comes from internal.
Yes.
So yes, you are coming where we want to bring the viewers to. Yes, go on.
So as we were saying, cancer is a disease of your own tissue that has become unruly, or it's rebelling against the natural order of life inside your body.
Okay.
So with breast cancer or with the cancer, whatever environment is created by the body or that we create in our own bodies to facilitate the growth of cancer cells will allow the proliferation of cancer. So naturally speaking, as we sit here, we are liable to create cancer cells, though the body will quickly identify to say, there's cancer, let's get rid of it. And our immune systems do take care of that. But in the event where we have more for the cancer than we do for against the cancer, we start to allow that imbalance and the cancer grows. So we've got, like we were saying, the risk factors that will then contribute to this environment. We've got risk factors that we cannot do anything about. For example, being female, I cannot change that I'm female, and because of that, I am more susceptible to breast cancer. The age, as you get older, you're more liable to breast cancer.
May I hold you there? We'll come to age later, but I wanted to come to a very important point of which a person will identify or realize that I have breast cancer. Many people do not know that I have breast cancer now. How does it manifest? I want you to bring it to people with more breast tissue and lesser breast tissue, the males and the females.
Okay.
And let's come there. How does a man, you might touch it all at once.
Okay. How does it present?
How does it present itself to both males and females? Okay.
Yes. So first of all, you brought in a very important point.
Yes.
Some people will think that because someone might have larger breasts anatomically, they might feel as though they have a higher risk of having, a higher risk of developing breast cancer.
Breast cancer.
But it's been noticed, some studies would say the more breast cancer you have, the more breast tissue you have, the more likely you are to have breast cancer. Some say there's really no difference in the amount of breast tissue that you have. So for males and females, females because of their anatomy and their hormonal physiology are already at a greater risk of developing the breast cancer. But for males as well, they will still present with the similar symptoms that females will have. So what are these symptoms that you were asking about? So sometimes, for most people, it's actually non-symptomatic. You might not actually know that you've got cancer and you have it. Then for
Is that possible?
Yes.
Oh, really?
Yes.
Okay.
So you could have it inside your breast and you might not know, especially for women with very large breasts. Maybe it's deep-seated inside and they can't feel the mass necessarily, but it's there. So some will be asymptomatic. For those who are symptomatic, they might present with changes to the breast itself. So the skin, there might be dimpling on the skin, there might be ulceration on the skin.
Which skin now? Skin on the breast itself?
Yes, on the breast itself. And the nipple as well. So the redness of the skin, you might see prominent changes. Some will say, like I was saying, dimpling, retraction of the nipple. You might even see a visible lump itself on your breast, right? And then you might feel something. If you feel your breast, you might feel there's a change in your breast tissue. some people, even right extending into your axilla or into your armpit rather, you might feel changes. Some will even see changes or masses around their neck, and that's maybe
That's the manifestation.
Yes, those are the manifestations.
Oh,
but,
wow.
But that's much later. That's when the cancer is already starting to move up.
Okay.
Yes.
So we call it stage 1, or still that manifestation. Is it stage 1 that it can still be treated, or is stage 2?
So the stages will differ: stage 1, stage 2, stage 3, stage 4, and the treatment modalities do differ across the different stages. And the stages are done clinically as well as using imaging and biopsy.
Thank you very much. We are just ending the first segment. We are not gone. Stay tuned. We are coming back with the second segment, and we'll hear more about breast cancer, a disease that needs to be kept, fought by both of us, male and female. Thank you. Welcome back to the second segment of the program, Health and Mission. Now, Doc, you were talking about the manifestations. Now, a person to just combat it in its early stages, how do this do what we might call self-examination? We've heard of self-examination and also screening. What's the difference between the two? And may it take us also to understand how they are done?
Okay, thank you for that question. So with breast self-examination, it's really yourself examining yourself, right? So it's very important, I always say to women, it's important for you to know yourself and to know what your breasts feel like, or anything in general, right? Because with age, changes do occur, and when they do occur, you must be aware what the changes are. So with breast self-examination, what we usually say is pick a day for the ladies, for the men as well, right? So for the ladies, you'd want to pick a day that is consistent, because we do know that the anatomy or the shape or the feel of the breast do change with our menstrual cycles. So you could choose a day to say, okay, maybe on the last day of my menses, or right in the middle of my 28-day cycle, or however long your cycle is. So you pick a day that you do know that on the 14th day, my breast should feel like this normally. And that's when you do your breast examination. For the men, it's really not going to change because men don't have menses,
Okay.
So what you do is you stand in front of a mirror, you use one hand, maybe the tips of your fingers.
Yes.
Yeah, you outstretch your hand, and you feel going round in circles from outside going in, and you really try to go deep, right? And you feel, and you feel, and you feel, and you feel your nipples, and you try to see if there's also a discharge. You go right into your armpit as well, because remember, your breast does extend right into your armpit.
Into your arm, yeah.
And you feel that. What are you feeling for? For changes in texture, for lumps, for pain, and anything that's unusual to you, right? And when you do that, you take note, is there a lump? Because 60% of lumps are actually benign. So you'd want to know. And it's important also to know that the feeling, the texture of your breast does change when you're breastfeeding, with your menses, and there's also just benign masses that are there. So the same applies for both men and females. And like I said, do it in front of a mirror so that you see, like we're talking about, the retraction of nipples, or the change in the levels of your breast, because we do know that there's a resting position, but sometimes with cancer, that position does change.
Right, we want to go to screening.
Okay.
Screening done by the medical professionals. How is it done?
Okay.
Is it similar to the one which one does at home, or that one requires machines or other advanced technology?
Okay, so when you do go to a healthcare provider, they will take a history. They'll want to talk to you about what's happening with your breast. Have you noted any changes, discharge, pain, lumps, all that? After they've taken a history, they'll do an examination as well. So they'll examine you, your breasts, and to feel for any unusual texture, lumps, whatever, as we were saying before. After that, they'll conduct what we call a mammogram.
Mammogram, yes.
Yes, which
That's
is
what,
an imaging technique that we
right.
use to look at the breasts.
It's the breast.
Yes. And then after that, if there's a lump or anything unusual, they'll carry out what we call a biopsy, where they take a sample, a small sample of whatever abnormality that is inside the breast. Then they'll look at it on a microscope and carry out further tests to see, is it really breast cancer or what is it? Is it a benign mass? What really is it?
You spoke about the tissue, which is different in both males and females, and you said the breasts might be different. But let's come home and try to picture the people who are most susceptible: bigger breasts, smaller breasts, male, female. Just highlight that ones.
Okay.
The susceptibility of those people. Is it similar, or it differs with the size of the breast?
Okay. Like I said earlier, there's conflicting studies on that.
Okay.
Some will say that the size of the breast does matter.
Does matter,
Some will
yes.
say it does not matter. But like what I was saying, perhaps for a woman with bigger breasts, it might be more difficult to feel for those lumps on her own than for a woman with smaller breasts who might be able to quickly note.
Oh, so bigger
that-
tissue is difficult
Yes.
to diagnose.
Not to diagnose necessarily,
But
for the self-examination.
For the self-examination.
It might be easier for a woman with smaller breasts to quickly note that there's a lump,
Okay.
because maybe it's more prominent on the skin than for a woman with larger breasts.
Okay. All right. So it does not matter whether it's big or small. The susceptibility is not decided by that.
No, it is not.
Thank you for clarification. It helps us, our viewers, to know more about that. Then the age group. We spoke about the growing older and the people. Which age group is most susceptible as well?
Okay.
Yes.
So generally speaking, the older you get, the more susceptible you are to breast cancer. So they say usually starting at the age of 40 for females, we start to do our screening.
Yeah, okay.
But if you've got a family history of breast cancer, we start screening much earlier because you are more susceptible to the cancer. Then for people who've got certain genetic predispositions or certain genetic mutations, BRCA1, BRCA2, that's the talk. Those people start screening much earlier than everyone else because they are more susceptible to the breast cancer at a much younger age.
Besides heredity, may you tell us if there are people who are contraindicated to certain medications, or let's say someone like, for instance, someone is taking HCT, some people end up having diabetes, if you concur with me.
Okay.
Yes. So what other things can be done medically that lead to a person contracting breast cancer,
Okay.
which people can avoid? Maybe somebody has diabetes, which needs to be kept earlier, somebody has BP. Which diseases can lead one to have breast cancer?
Okay. So breast cancer is supported by estrogen.
Okay.
Right.
Yes, which is a female hormone.
Female hormone.
But
yes.
we have males who are also having breast cancer.
Yes.
So which hormone works in males? Because you have started talking about estrogen.
Estrogen.
You have not spoken about testosterone.
Yeah.
So where's the link there? When somebody has testosterone, someone has estrogen, but both of them can end up having breast cancer.
Okay.
Yes.
So I was just going back to the question you asked to say, are there medications that can actually predispose other people to develop breast cancer?
Yes.
Yeah. So we've got, when men have prostate cancer, and they're treated using hormones, some of the medications that they do use are estrogen-like. Yes.
Estrogen-like.
So
Right.
sometimes for men who are on hormonal treatment for prostate cancer, they can end up developing.
That's why I wanted to come on. Yes. So when you are being treated of prostate cancer, it might end up giving you breast cancer. So you need to be careful when you are being treated to have frequent checks.
Exactly.
Okay. So now we have come to the end of our second segment. You bring us more educational information as we we go to the third and final segment.
All right.
Stay tuned, viewers. We are coming with the third and last segment. Welcome back to the third and final segment for the program Health Mission. Today we are talking about breast cancer, a disease that is bedeviling both male and female genders. Now, Doctor, we want to come to the remedial actions.
Okay.
A problem without solutions is not final. So what are the remedial actions which can be taken for a person to be? We will notice that there are surgical procedures that are being done. Some are getting their breast removed. Is it the way to go when we have reached the stage, the final stage?
Okay. So I'll talk about maybe the treatment options that are there, like you're saying. We've got surgical treatment, like you said. We've also got chemotherapy.
All right.
Yes, which is basically using drugs. Then we've got radiotherapy, which is using X-ray-like waves.
X-ray, right.
Yeah.
We call it kupiswa.
Yes, kupiswa.
All right.
So those are the treatment modalities that are there. I'll be quick to say that treatment is always tailor-based to an individual.
Okay.
So we won't quickly say for everyone go and get surgery or go and get radiation or chemotherapy, but it's always tailor-based to the patient, how they've presented, what they've presented with, the complications that they're presenting with, the age of the patient, the wishes of the patient actually.
Okay.
Some people will say, I don't want to have my breast removed. So really, it's always to do with whoever has presented with the condition.
But does it not rot when you don't get it removed? Yes, they might be interesting, and yes, they might not like it, but what happens after that if it's kept intact?
Okay, so depending on the stage, we spoke about stage earlier.
Yes.
And we also spoke about, we didn't touch on it, but we've got cancers that are sensitive to certain hormonal therapies as well.
Okay.
So sometimes your healthcare provider could offer you that option, considering all investigations that have been done, to say maybe for your cancer we can go with radiation, we can go with hormonal therapy, we can go with chemo only, or for you we would really have to remove the cancer. So like I said, it's difficult to have a one-size-fits-all for everyone, but it's not to say that at all times removal of the cancer is the way to go.
Okay, my second last question is, Doc, as a missionary yourself, you will drive people to acknowledge how God has created them fearfully and wonderfully made, and having the most important anatomy on a human being. What other means which does not intoxicate their bodies in the natural way, naturopathy, if we might say it?
Okay.
Yes.
Okay. So we are so blessed as a church to have the health message as a part of what we believe in strongly. And a denial of that health message is a loss on our own part. And I would like to say that there is so much wealth in natural medicine and the naturopathic aspect of treatment even, and an interplay of both. It's not to deny, to say that we do not
go the conventional way.
Yes.
Okay, we can dually use both.
Yes,
okay.
yes. Like for example, if a patient comes in and has the cancer removed in one of her breasts or in one of his breasts, would still want to protect the other breasts, right? The other breast, right?
Okay.
So we still continue to bring in the
natural way to protect the remaining one.
Yes.
Okay.
And to improve outcomes long term.
Okay.
For as long as we have not changed the conditions that supported the cancer in a patient, we can never really truly say we've conquered it.
Okay.
Yes, so even if you've had conventional treatment, you can still benefit from this end. There's also some people who go radically to say, I don't want to have conventional treatment at all, and that it's up to them really, and it's up to their commitment to the resources that they have available to themselves. And if they can go that way, some people have had beautiful testimonies from that. However, like I said, treatment is always tailor-made to a person's options and preferences.
Okay. Doc, on naturopathy, there are certain people who have said, if I take only these herbs, there are concoctions that are coming, some which are assumptive, which are brought on groups. The health groups are now plenty. They are wash. And when you look at them, they are sort of confusing the people. So you have said it is best to go both ways.
I will say we need to be very careful. Though it's
careful is the underlying word. Yes.
Although maybe it's really beyond the scope of our presentation today.
Okay.
But what I would say is we must not be quick to say there's one herb for my condition.
Okay.
Because really and truly there's nothing like that.
There's nothing like that.
Yes. God wants us to be holistic about everything.
Okay.
We have no one herb treat all approach
Okay.
when it comes to lifestyle modifications for chronic diseases, any chronic disease really. When we do that, we become nganga
all right.
or herbalists, other than because really what God wants us to do is to come back to a place where our body heals itself.
Yes.
And not to rely on what was that herb for COVID? On ginger or garlic or anything. But to support our own bodies to start to heal themselves.
Okay.
So that option really is not holistic already. But when it comes to lifestyle modification, you must teach when it comes to nutrition, exercise, the use of water, the use of air, the correct use of
the new start.
Yes, new start in
trusting God.
Ultimately, that is He is the healer.
Okay.
We might do everything, and when we leave God out of it,
it does not work.
We won't get results. So yeah, that would be my answer, to say conventionally we have the benefit of investigations, of really knowing what's happening. So we wouldn't say conventional treatment is out completely.
Okay, so it helps in diagnosis.
Yes.
But if diagnosis has been done, then it will lead into even how nutrition is done. Because when you do nutrition without diagnosis, you might end up doing nutrition wrongly, in as much as it is correct in its usage.
Yes, you could treat supposed cancer when it's really not cancer.
Yes.
For example. Yeah.
As we are closing, Doc, we want to come to a very important thing, which you might not do without in any of the health and mission programs. Your Jesus factor, as we close, to people suffering with breast cancer, to those who are affected by it, with relatives who are bedridden or having challenges with breast cancer.
All right.
Your Jesus factor.
I'll share my favorite verse, actually.
Okay.
John 10, verse 10.
Yes.
It reads, the thief comes to kill, to steal, and destroy.
Yes.
But I have come that they might have life and have it more abundantly. To me, really, it's the summation of why Christ wants to be a part of our life and what we benefit when Christ is a part of our life. Be it we're suffering physically or emotionally or mentally or spiritually. Christ comes so that we might have life, but not only life, life more abundantly. Yes.
Thank you, Dr. Alvina Makrumidze, for gracing this show.
Thank
May
you.
God bless you.
Thank you.
We will see each other on the next episode of the program Health and Mission. Goodbye.